Stribild. Hello folks, Mark Medical's here teaching you about the latest HIV treatment, HIV symptoms, the latest HIV cure news, HIV testing, HIV transmission, and everything about HIV infection. Today, let us learn the basics of the HIV treatment Stribild. Here are 7 facts about Stribild. 1. Just like any HIV treatment regimen, the role of Stribild is to help you eliminate all HIV from your blood till an undetectable viral load. 2. Each film-coated tablet contains 150 mg of elvitegravir, 150 mg of cobicistate, 200 mg of emtricitabine, and 245 mg of tenofovir disoproxil. 3. Stribild is used in HIV treatment for people over 19 years of age who have never been on any antiretroviral therapy. Studies have also proved that Stribild can work very well in 12 to 18 years HIV clients too. 4. Stribild should be taken with food. And take a replacement pill if you vomit 1 hour after, and take another pill if you have missed your pill in less than 18 hours. 5. Stribild should be taken cautiously in elderly people and in people with kidney and liver problems. Stribild also has the potential to weaken your bones. 6. Mark Medical advises you to stop Stribild immediately you are diagnosed with hepatitis B and consult your doctor. 7. Ask your doctor to switch you to another regimen immediately you fall pregnant. Alright, want to learn more about HIV treatments? Subscribe today.